Healer to witch pipeline, pattern analysis, why midwives and herbalists were targeted. If you could heal people, they would accuse you of harming them. That's how the trials worked. Healers were primary targets of witch trials. Midwives, herbalists, wise women, the people who helped their communities, who delivered babies, who treated illnesses, who knew plants and remedies, they were accused at disproportionate rates. And it wasn't random. Here's the pattern. Healers had knowledge. They understood the body. They knew which plants stopped pain, which herbs induced labor, which remedies treated fever. In a world without doctors, or where doctors were only for the wealthy, healers were essential. But that knowledge made them dangerous. Because if you could heal, people believed you could harm. If you knew which herb stopped bleeding, you must know which herb caused it. If you could help a woman give birth, you could curse a pregnancy. If you could cure a fever, you could cause one. The logic was simple. Healing and harming were the same power used differently, and when something went wrong, a baby died, a patient didn't recover, a treatment failed, the healer was blamed. Not for incompetence, for witchcraft. One case in Germany, a midwife delivered a stillborn baby. The mother accused her of killing the child with magic. The midwife was tortured. She confessed. She was burned. Another case in Scotland. A woman treated a man's infected wound with an herbal poultice. The infection worsened. He died. His family accused her of cursing him. She was strangled and burned. In England, a woman was known for treating headaches with willow bark tea. When one patient's headache didn't improve, the patient accused her of witchcraft. She was hanged. The trials didn't just target healers randomly, they targeted women who had power in their communities, women who were consulted, trusted, paid for their services, women who operated outside male-controlled institutions, the church, the emerging medical profession. By the 1600s, universities were training male doctors, the church was formalizing male clergy as spiritual healers, and traditional female healers were competition. Accusing them of witchcraft removed that competition. Some historians argue the witch trials were, in part, a campaign to eliminate female healers and consolidate medical and spiritual authority in male hands. Whether intentional or not, that was the result. Thousands of healers executed, their knowledge lost, their communities left without care, and male doctors and clergy filled the gap. How many medical advances were lost when we burned the healers? Comment healer if you see the pattern. Follow, like, and share for more systems designed to destroy women's power.